Hi guys, thanks for joining me. I am Dr. Ayele Okine and this is This Vet Wants You to Know. Today we're talking diabetes. We always start with a low dose of insulin. Basically, the worst thing we can do is to start too high and cause a pet's blood sugar to drop into the dangerously low range where it can be life-threatening or cause things like seizures. So we always start low and we slowly work our way up, but we always want to give the pet time to adjust to the insulin. And so we don't want to make changes to the insulin faster than, once a week or once every other week. So we really have to take things slow. The way that we assess the efficacy of our insulin dose is to do a glucose curve. And basically that's going to be either a glucose curve in the hospital where the pet comes in the morning, first thing after breakfast and insulin, and we monitor their blood sugar every hour to every other hour, for about 10 to 12 hours. That's going to tell us what does the blood sugar do after the insulin's given, how low does it go, and then how long is that response. Really what we're hoping to see is a blood sugar ideally in the 200 and 300s. Sometimes we'll get a little bit lower than that, sometimes it'll be a little bit higher, but it's really a combination of how does the pet feel, are they maintaining their weight, what's their thirst and urination like. And then also the numbers is going to be important as well. We want to make sure we're not dropping things too low. In people, it's really important that the blood sugar stays in the normal range because a lot of people will have cardiovascular issues from having a high blood sugar. Luckily in pets, probably because they don't live quite as long and they also tend to be resistant to things like atherosclerosis from having a high blood sugar, we don't have to get them normal. The other thing too is pets can't tell us if they're feeling, a little bit lightheaded or if they feel like their sugar's too high or too low, and so we have to infer that information by watching them and checking their numbers. So we don't have to be quite as strict with them, which is nice. Now, when we have a pet that they're dropping too low, or we're finding that our blood sugar after the glucose curve is remaining too high, all that information tells us is if we need to lower or increase the dose. It doesn't tell us what the target dose is. So typically we're changing insulin doses by about 20% or so, sometimes a little bit more, but we really have to take it slowly and we have to repeat these glucose curves every time we change the insulin dose. The other option for a glucose curve is to have an owner do the curve at home, and they can actually buy the glucose monitor that we use in the clinic called an Alpha Track or Alpha Track 2. And they can do the same thing, starting with breakfast and morning insulin. They can check the blood sugar every other hour for 12 hours and then send that information to their vet to analyze. I tend to have people not make changes based on a high value, but if we are finding that the pet is dropping too low, like below 100 or so, that they contact me right away so we can make changes and cut back on the insulin. But again, it's going to take time to get regulated. And in some cases, there's pets that we're constantly having to change things and they're never regulated. But I usually have people be patient for several months while we're waiting to get things under control. The last thing that we'll do as far as the glucose curve is concerned is something called a Freestyle Libre. So it's actually a human sensor and reader that is actually worn. So there's a little small filament that reads the blood sugar underneath the skin in the interstitium, and it's been validated in pets. That's probably one of the few human glucose monitors that's been validated in pets. So again, we don't want people to go get the human monitors that where you prick a finger, those are not validated, but the Freestyle Libre is, and the pet can wear it. Now, the Freestyle Libre for people is supposed to last for 14 days. In dogs and cats, it tends to not stay on that long because they are haired. They have fur. Obviously we shave it, we use a little bit of skin glue to help with that, but oftentimes it doesn't stay on as long. So I have people put the sensor on the day we want to get the reading, so that way if it only stays on, 12 or 24 hours, we have the data that we need. If it stays on longer, great, but again, I just need at least a 12-hour curve so we know what is happening after we give insulin and feed. So that's another way where a pet can have the sensor placed in the hospital, they can go home with it, and then they can have glucoses read at home and be comfortable and not be poked and prodded. The owner does have to download the information from the reader. I believe it's every 8 hours, otherwise we lose that data. So either people can scan the sensor with the reader and write down the numbers every couple of hours, or download the data that comes from the sensor every 8 hours so we have that information. It's a really great system. It's kind of nice, but again, I caution people from getting overwhelmed by the specific numbers and really to only panic if we're dropping the numbers too low. So those are the ways that we monitor the blood sugar once we start insulin, and so that information is really important. There is a blood test called a fructosamine, which basically is looking at the sugar bound to proteins in the bloodstream, and that's something that changes slowly over about 2 to 3 weeks, so it gives us the average blood sugar. The problem with the fructosamine is it's giving us the average. So, if we're having a patient that's staying in the perfect level, great. If we have a patient that's having high and low swings, well, the average of that might look perfect and they can be really sick. So it's hard to kind of interpret the fructosamine unless we have a patient that's really doing and feeling well. So I tend to prefer the glucose curves. So diabetic patients can be tough. Any client that's dealing with a pet with diabetes is a rock star in my book. I give advice, I tell them, to do X, Y, and Z, but ultimately it is a hard disease to manage because you have to be around and be monitoring the pet, giving insulin twice a day, and really making sure that they're eating and drinking and maintaining themselves. So it gets hard if you have plans one night. You really have to be around to give that insulin 12 hours apart. If you go out of town, you got to make sure that there's someone that can do that, and so it really can kind of rule your life. The other thing to keep in mind is dogs almost always become blind when they have diabetes, and that's really because of how the lenses of the eyes metabolize sugar, and so oftentimes that can be something that's difficult to deal with. Now the good thing is dogs tend to learn their surroundings, so as long as you're not moving or changing furniture around or changing the routine, they can do just fine being blind, and they actually are very confident and comfortable. There are ophthalmologists that will do cataract surgery, so they can actually remove the affected lens and replace it with an artificial lens and restore vision. And a lot of those dogs are just so happy to have their vision back that they really seem to thrive with that. But it is expensive, and so it's not something that is mandatory, but it is something that can be done. Cats don't get cataracts from diabetes, so we don't tend to have to worry about that. But again, it's a lifelong disease in most of these guys, and it can be really tough and hard to deal with. But that's kind of my diabetes spiel. There's a lot more information that we provide our clients with. There's videos on YouTube showing how to give insulin, so there's a lot of good resources out there. But this is kind of just my summary, kind of what I start to go through with clients as we begin the journey of managing their pet with diabetes. Again, as always, please subscribe, please share these videos if you have a friend who has a pet with diabetes, or if you have someone that's really curious about what we deal with in veterinary medicine, please share. Also, be sure to comment, like the videos, give me feedback. But again, I will see you on the next episode. Thank you.